He's tried cortisone injections, sclerosing, or alcohol injections with very little success. So now we're kind of at a fork in the road where do we go the surgical route or the cryosurgery route. Cryosurgery is very specific, it's minimally invasive, so with a little stab incision, we'll ultrasound guidance a probe in there, identify the nerve, and do two-minute freezing cycles, okay, to help kind of regenerate that nerve, all right? So let's enjoy the procedure, all right? Okay, do you feel anything?
No.
No, okay, maybe come around this side. So just a little stab. Move this a little closer here. All right, so this is the probe. All right, we're gonna go in that little stab incision. All right, and it's just gonna be a little bit of resistance at first. Are you doing okay? Good. You're gonna kind of give. All right, and now we're into that tissue and we pull up. All right, and you're gonna see how those two toes go down. That lets me know that I'm underneath that transverse intermetatarsal ligament, which is kind of where that nerve is. So we're at 2-minute freezing cycle. So basically what we're gonna do is we just hold the probe here. All right, we visualize it. I like to spend some time with the ultrasound to make sure obviously we're in the right spot, so it works, okay? And then what we'll do as it forms, I'm gonna put it on there again so you can kind of see that black ice ball that's forming, okay? Ozone, basically O3. So we take oxygen from a tank, convert it to O3, so it's like hyperbaric oxygen, if you will, that we inject in the foot. Just like the PRP, it's got regenerative properties, so in essence, you're throwing everything at this, including the kitchen sink, to make this thing get better. Okay, great. So we have 1 more minute left of this. And then you're on the road to recovery, right? Back to biking.
I've had the stem cell on both knees and both shoulders, so.
Works well.
Yeah, it does.
Works well. I've noticed that by itself, I haven't had as good results with nerves,
Yeah.
okay? But in conjunction with this, it's worked really well.
Yeah.
So.
Well, the great thing about this is, you know, not having to remove that nerve and that stumbling on the thing, and
Correct.
that scared the hell out of me.
Absolutely. Just start all over
That's
again,
why,
right?
that's why I never did anything
Sure.
for 10 years, you know, I just
Well,
lived with it.
You know, the nice thing, like we said with this, it's got an 80% success rate. God forbid it didn't work, okay? There's still other options available, right? Whereas the surgery, you cut it out. If it doesn't work, you're kind of stuck, you know?
Yeah.
All right, almost done. That's it. Once it's done, it kind of wiggle a little bit because it's frozen inside your foot, okay? And then it kind of will just pop up.
All done?
That's it.
Wow.
Okay. So what I'm gonna do, I'm gonna clean this off first, all right? Is I'm just gonna put a tight wrap around it for right now, and then I'm gonna go draw up the PRP, and then we'll come back in, and they're gonna be on the top, those injections, all right? Any issues or problems right now? No? Good, excellent. Okay, cool. All right, so now here we have the PRP we're gonna draw up, all right? So drop about 6 cc's, you can see the red cells and the platelets. So usually I go kind of right above the platelets down there, so we wanna get that tissue. If you get a little bit of, red cells, if you get a little bit of them, that's all right, but you kinda wanna get that foggy layer in between there, okay? 2 to go. So I get usually about 1.5 cc's of each from each vial, just so I don't dilute out the product. I try not to take too much of it. In 1 second, we'll show you the ozone. We're going to get the ozone drawn up as well, and that'll be the last cog to the cryosurgery, PRP and ozone. So I'll see you in a second. Okay, here we are. This is our oxygen tank. This is our system. We turn it on, it's going to start cycling oxygen from O2 to O3. So basically what we do is, it does have a pretty bad odor to it, believe it or not. So we hook it onto here, all right? You can see how it kind of pushes it out pretty quick. If you don't hold it, it's going to hit you in the face. So let it fill up a little bit, turn it off. You're going to hear it kind of like gas, give a little bit, and then we hook it right up to the syringe, okay? So now we're ready with those two. We're going to go in and see our patient and get them going. Okay, so now we're going to do the last part, which is the PRP with the ozone, all right? Don't mind the construction in the background. So he's already numb in this area. So we have PRP, ozone, and the other PRP. So basically, I'm going to kind of come in from the top here where the nerve is, and just inject the PRP, all right? And I'm actually gonna move it around because what it does is it allows for better breakdown and regeneration of the cells, unless, you know, you're not doing it in one spot, basically. You're doing good, all right, right? So, almost done with this guy. And this again just helps to aid in hopefully knocking his nerve out for good for him. The second one I'm actually gonna kind of go between the toes again, so it's just a different plane that we're gonna be doing it in. Obviously cover up the previous little incision so it doesn't squirt out it. And just pepper that area in there a little bit, okay? So we do some. Without an anesthetic, you probably would have wanted to kick me in the face by now. Yeah? A little bit more and then we'll be all toast, all right? Still doing good, right?
Yeah.
Excellent. All right, last one is the ozone. It doesn't look like much, but it actually has the O3 that we pulled up in there. And basically what you'll do, again, we stick it in and you're gonna see, it just kind of, you may see some of the skin kind of pop up. You can see it back there. So the oxygen's kind of filling those voids, going a little bit further. And it's creating that, and you know, helping to create that regeneration process. So, like I said before in the video, usually the combination of the cryo with the PRP and the ozone, it's really the best technique we found to try to eliminate these nerves pain as non-invasively as possible, or minimally invasively as possible. So basically we're gonna put a wrap on the foot. This wrap's gonna stay on until tomorrow, and then you can take it off and treat it just like a basic cut. He will be given a boot that will have to be in for about a week, all right, maybe 2 weeks at most, and then he'll transition out of it and kind of go from there. So if you or a loved one has a nerve that's giving you any issues, please feel free to give us a call, like our YouTube channel, our Facebook page, and if there's anything we can do for you, we're here to help. Thanks, guys.